Welcome back to the show. Dr. Zach back, and of course, I'm sure you heard the tragic news of this 18-year-old girl who passed away of meningitis complications, of course, due to meningitis. And Dr. Zach is here to talk about meningitis. And before we start, first of all, welcome. It's great to have you here. One of our colleagues here at Breakfast Television got in touch with Jean-Nicolas Aubé, who's the Senior Public Relations Officer for the CIU-SSS. And he, I just want to read some of the things that he had to say here. Was that it was very rare and severe, the type of meningitis she had. It's the only case that they've seen in the province of Quebec in 2019. It's the only case since 2017. They said that everyone that was in contact with her, about 90 people, everyone's been interviewed. The 15 people in direct contact, they've been given medication. So just wanted to share that information before we go over to you, Dr. Zach.
Yeah, that's good.
Let's talk, what is meningitis exactly?
So meningitis it's an infection. It's an infection around the brain, around the lining of the brain.
Okay.
And this one in particular is meningococcus, which is a type of bacteria. It's Neisseria meningitidis, and it's one of them that can cause a very severe meningitis. It can cause other things as well, which is a bacterial infection in the blood, which can also be deadly, by the way. And it's scary because it's a young, healthy person, and when people do get sick with it, it can be deadly, as we see. It can be very, very quickly deadly. So it's scary, and it's a scary story for all of us. It's tragic.
Yeah, absolutely. So is this a new strain?
No, it's one of the, so there's a bunch of strains.
Are there many? Okay, so there are many different strains.
There's basically 5 that can cause disease. And this, ultimately, yesterday they announced it was a B type.
Yes.
And the other ones are A, C, W, and Y.
Okay.
And the one that is covered in terms of vaccine here in Quebec, which is given at 12 months of age and also in Sec 3, is actually the C.
Okay.
Because that's the one that's caused epidemics in the past. The B, there are vaccines for all 5.
Okay.
And the B actually is available, but it's a choice, so it's not covered by the government.
I see.
So that's something worth talking to your doctor about.
Right. If you have your concerns, certainly you should.
Certainly, if you've had contact. One of the nice things. There's nothing nice about this bacteria, but unlike, it's probably like he said, unlike flu and the common cold and measles, it's not as contagious.
Okay.
So it's not just like talking. You're not at high risk. It's really like more.
So how do you contract?
Much more intimate.
Okay.
Typically, now if you live in the same house, then you're considered a close contact.
Right.
If you're intimate with a person, right? If you're kissing, that sort of thing.
Right.
But just being in the same room, you're not considered a serious contact. And so it's certainly healthcare workers, when I've been in contact with it, certainly doing procedures involving the secretions, because that's where it is. It's in the saliva, it's in the mucus, that sort of thing.
Right.
But you need a fairly big exposure. That's the good thing about it. Having said that, there's nothing good about it once you catch it.
What about symptoms? Because I hear it can be difficult to diagnose because some of the symptoms are very much like the flu, for instance. Yeah,
so basically people feel terrible like the flu, but if it's meningococcus in the blood or meningitis, the difference with meningitis primarily is severe headache, stiff neck. Meningococcal meningitis or meningococcemia, that tends to cause a rash. It's like a bleeding rash, like a very severe. If you Google it, you'll see it's a bleeding type rash. You can get it on the face, you can get it throughout, you can get it on the extremities, and it's very impressive. And it's a rash that if you press it, it doesn't go away because it's actually bleeding under the skin.
Really? Okay.
Yeah. And then people also come in with altered mental status, so like they're confused. Sometimes they have seizures, vomiting as well. So yes, it can be like a flu initially, but people get very, 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 very sick very, very quickly. So hopefully you realize that it's not just a flu and you get to the hospital as soon as possible.
Obviously, it is treatable. I imagine time is of the essence like anything, but what are the treatments then? It's
antibiotics. I mean, you've got to get the antibiotics in right away. You need intravenous antibiotics. Generally for meningitis, that's the treatment. So meningitis, by the way, it can be viral, and those ones are much less severe and less deadly. And they tend to go away, usually with conservative management, but they don't kill people. Like the bacterial meningitis is a medical emergency, and the treatment is, number one is IV antibiotics, strong antibiotics right away. In addition to that, we give other things. Steroids has been shown to help intravenously, and also fluids. And then we treat whatever other thing. Often these people, if they're so altered, we often will intubate them, which means put a breathing tube in because they're not able to control their airway. They often have to go to the intensive care unit. Sometimes their blood pressure crashes and they need medications to keep their blood pressure up. But the bottom line is getting them treated right away and getting those antibiotics in right away.
Yeah, and want to just reiterate the fact that this was a very rare case. It's the first time we've seen it in 2019. It ended up to be a tragic case, but the first time since 2017 as well that we've seen it in the province. Thanks so much for joining us. Really appreciate it. We'll be back with more BT right after this.